Hello, it's Dr. Christine Arseneau, Pharm.D, Functional Medicine Certified Health Coach. Wanted to talk about mold today because I just attended a mold conference over the weekend that was put on by ILADS, which is the International Lyme and Associated Disease Society, so there's a lot of Lyme literate practitioners there, and mold and Lyme tend to go hand in hand. So mold is an important topic for people that have Lyme. Sometimes there could be a mold issue that you are not aware of that is affecting your healing. So just wanted to talk about how the two go hand in hand. And just in general, oh, my dog's talking to me. We're going to go to the beach in a little bit, okay? Soon, okay? So when you are overgrown with a bacteria that's not supposed to be there, a lot of times that can be because there's an issue with the terrain, as in your body, and you are a body that is allowing pathogens to take over. And the more pathogens you have, the easier it is for them to take over because your immune system kind of gets bogged down more and more and more. So mold actually makes Lyme worse. So mold causes T and B cell deficiencies. Your immune system can't respond as well to the Lyme bacteria and other issues going on. Mold increases inflammation. In fact, the fungal system in your body, there are some natural fungal species that are supposed to be there, and their whole goal is to modulate inflammation. So the fungi, the mold, these things are part of your microbiome, and they are meant to be there in a certain ratio, but they're not meant to, overgrow, take over, and cause disease. So it's all about balance. And at this conference, they also talked about antibiotics tolerance and resistance. 4 weeks of antibiotics just is not enough because the Borrelia divides so slowly. And also, many antibiotics are actually derived from mold. So sometimes people who are sensitive to mold can have a severe reaction to some of the antibiotics, or just don't tolerate them as well because they're actually reacting to the antibiotic itself. So it's a little bit tricky, just like pretty much everything is with Lyme. So here are some questions to ask yourself if you're thinking, well, I don't think I have molds, or how would I know if I have mold, or maybe is this an issue for me? Has your work or your home been flooded recently, or have you ever had water damage? Maybe you've remediated a house, but sometimes, a lot of times, those are not 100%. There can still be spores that persist, so there could still be potential issues there. Have you ever noticed mold in your work or at home? Your car is a big one. I had a car once that the back seats always got damp, and I ended up selling it, and I suspected that was part of the issues why my labs were off, indicating I had mold exposure, although I also had some mold in my apartment, so it gets kind of tricky to pinpoint exactly where it's coming from. Maybe are you and your coworkers sick, or your family members chronically ill with the same symptoms? Do your symptoms get worse on rainy days? Are you exposed to dust, chemicals, or fumes at work or otherwise? And do your symptoms change when you are in a particular location? Maybe your symptoms are worse or better when you're at home versus when you go on vacation. So those are some questions to ask yourself, some things to be aware of if you're thinking maybe mold is an issue for me. And so how do we test for mold? There's a few different tests that we can do. Urine mycotoxins are pretty common, as well as serum. There are a couple different urines. There's ELISA, there's different mass spec options. Sometimes the urine is good at telling you your overall body burden, but if you're really not good at detoxifying, or if you have any kidney issues, that test might not be accurate. So you might want to consider a serum test. It's kind of like with Lyme disease, there's not necessarily one test that's going to work for everybody. So you might have to do more than one to really get a clear picture. And there are some other tests that you can do as well, such as MMP9, MSH, Marcon swab, which is a nasal swab. If you have Marcans in your nasal passages, you'll want to treat that because that makes treating mold even harder. TGFB1, VEGF, VIP, C4A, which tells you how inflamed your brain is. So those are all tests that can kind of help you put the puzzle together to see if mold is potentially an issue for you. And what is CIRS? So CIRS, it's a multi-system, multi-symptom disease. And if you go to the survivingmold.com, which is a great website, a great reference to check out, they define CIRS as an acute and chronic system inflammatory response syndrome acquired following exposure to the interior environment of a water-damaged building with resident toxigenic organisms, including but not limited to fungi, bacteria, as well as inflammagens such as endotoxins, beta-glucans, and possibly spirocyclic dramines, as well as volatile organic compounds. So basically, after being exposed to damaged water-damaged building, you have many toxins that you are breathing in that are getting into your system. And spores are something that you can breathe in. IgE tests can be helpful. You can have asthma and mast cell and things that are caused by the spores. Mycotoxins are smaller than the spores, so they can really get into your body system, and you can be colonized with mycotoxins. Biofilms, we know how Lyme causes biofilms, the bacteria that causes Lyme. Also, mold can cause biofilms, so just another hurdle to get through when treating. The mycotoxins, they deplete your glutathione, they cause mitochondrial dysfunction, they're cytotoxic, they can cross into the blood-brain barrier. So mycotoxins are not something to be taken lightly, and again, they are doing things to suppress your immune system, which is going to make your Lyme worse if you have that as well. So they deplete the immune system, it becomes this chronic thing, they're in charge of inflammation, so they're driving inflammation like crazy. They get into your small vessel vasculature, and that's why lymph drainage and heat, sweating is important. But let's go back to just the symptoms in general. There's so many symptoms, I just thought I should cover these. And I know some of these a lot of them really are not specific to mold itself. They could be specific to tick-borne infections or something else. They could be a symptom of other things as well. But I'm just going to list them because there's so many, and these aren't even all of them. So if you have quite a few of these, mold might be something that you just want to investigate. If you're treating Lyme and nothing's happening and you're not getting better, it could be because there's a mold issue. So some of the symptoms of mold and CIRS, we have brain fog, static shocks, vertigo, fatigue. Extreme fatigue can be a big one with mold, as well, of course, as with Lyme too. Mood swings, night sweats. That could be babesia, but it could also be mold. Red eyes, blurred vision, shortness of breath, sinus congestion, tingling, numbness, tremors, unusual pain. Sometimes it can be like a fibromyalgia kind of picture. Unusual skin sensitivity, so just really sensitive to the touch. Disorientation, confusion, metallic taste, tearing of the eyes, appetite swings, increased urination, also increased thirst, difficulty regulating your body temperature, abdominal pain, diarrhea, just kind of abdominal issues in general, cough, headache, light sensitivity, weakness, memory impairment, difficulty concentrating, decreased word finding, joint pain. A lot of these I'm sure sound familiar to you. Cramps, morning stiffness, anxiety, panic disorder, ringing in the ears, and POTS. So all of these symptoms could be attributed to mold. They could also be attributed to certain other tick-borne infections or other things. Just important to be aware in case you suspect that mold could be an issue for you. So if you are exposed to mold, what do you do? So you kind of have to peel back the layers just like you do with Lyme and take things one step at a time. It's complicated. You can't just hit it all at once. But avoidance is important, so get out of the mold. That's the number one thing that you need to do, get out of the mold. Avoid foods that contain mold, things like corn, coffee, peanuts. Fundamentals of living a healthy life. Get outside, move your body, just go back to the basics, focus on sleep, nutrition, anything that's in your control that's going to make you healthier is going to support your immune system so that your body can better take care of things. So just focusing on the fundamentals of health. Protect, repair, and fight. So we want to repair our system. We want to get our microbiome back in balance, and then we want to fight and treat the mold. But you have to go back to the basics and really build your system up, because if you're treating and you don't have a healthy system, you don't have healthy practices in place, and you're just continuing to take toxins in, then it doesn't really matter what you're doing as you treat, because you're still putting toxins in. You're still you're kind of just wasting your money at that point. So you want to do what you can in your lifestyle first, get back to the basics, get as healthy as you can, so that way when you start spending money on treatments, they'll actually work. And then you want to kind of do things in a certain order too, and make sure that all your pathways are open before you just start binding. Because if you're binding but you're constipated, that's not going to do you any favors. If you're binding up but you're constipated and the toxins aren't going anywhere and they're staying in your system. So it's important that you're sweating and you're peeing and you're have bile that's moving, and that you are focusing on being healthier in general and have all of these things on your radar. So when we look at restoring the immune system, the solution to pollution is dilution. So basically lots of high quality fats. You just want to flush your system out with really high quality fats and repair some of those membranes and dilute the lipid soluble toxins. So these toxins are lipid soluble. You want to dilute them as much as you can. So copious amounts of clean, correct fats. So you could do phosphatidylcholine, essential fatty acids, coenzyme Q10 is important. You also want to restore your fat-soluble nutrients like vitamin A and vitamin D. So restoring your phospholipid balance. Vitamin D is important for mold, also for coronavirus, for Lyme. It's just a really important vitamin. It's actually a hormone, but very important for the functioning of your immune system. We want to push bioflavonoids, specifically polyphenols like in green tea. Green tea is antifungal, antibacterial, antiviral. We want to decrease inflammation. We know that the mold is causing inflammation everywhere, so we want to take charge of that, do what we can to decrease inflammation. Support detox and restore mitochondrial function. And then, the bile too. The bile can be laden with mycotoxins, so that needs to be on our radar as well. So aloe vera is something that can soothe mucosal tissues, can help with inflammation. It's also a bit of a binder. We want to feed our microbiome. We want to repair. We want to feed our microbiome with healthy bacteria that is going to help support our system. Karma, what do you want? Come here. My dog is very adamant that it's time to go to the beach. She got the time wrong, so we're working on that. Quercetin is something that is really important for your immune system. That's really important for anybody that has mast cell issues as well. And the liposomal might be a great way to go for that, as it has better absorption. Artichoke supports detoxification and the immune system and lymph. Again, the mold depletes coenzyme Q10, so that's something that you might want to supplement with. Garlic can combat resistance, as well as thyme, the spice thyme. Oil of oregano, that's a great one for killing off fungal species as well, and that's okay to give with antibiotics. Pau d'arco is a strong antifungal that even works on MRSA. And I mentioned IV phosphatidylcholine, butyrate maybe, those are good as well. And so basically, in order to really heal, the body has to clear the debris, the waste, the toxins, and the pathogens. It's got to clean that all away for successful healing. If you have all those toxins living on you, it's just burdening your system, and you won't be able to take care of the bacteria that's there. So the lymphatic system is extremely important. That's the brain's own detox system, the brain's own drainage. And basically your body needs to be running at peak performance, so that the lymphatic system and the glymphatic system, the brain, the lymphs, the mitochondria, everything is working. We want things to be excreted through the skin. So we need to do what we can on on a physical level, without even going to the doctor or spending money on supplements, what can you do for your lymph? Well, your lymph needs to be moved. It doesn't have its own pump. So a rebounder, buy a little trampoline, buy it one time, and then you have it, and then use it. And just doing that jumping, getting that lymph system going. You can do lymphatic massage as well. You can use a dry brush that before you get in the shower, dry yourself, brush yourself with the dry brush. That'll get things stimulated. Sauna, infrared saunas are great. Exercise, whatever you can tolerate. I know some of you are not able to tolerate much exercise, but getting outside, doing what you can, short walk, something gentle. Breath work. Breath work is something that is really important for detoxification. That's totally free. It's all about consistency and practices and doing what you can in your life to help you so that when you do spend the time and energy and money on going to the doctor and getting medication and getting supplements, if you're doing everything first, all the basics, all the fundamentals, then it's going to go a lot further than if you're just trying to bind up some toxins, but you're not making sure everything's working correctly and you're still sitting in a mold-infested house. Avoiding constipation. That is another really important thing. So not moving toxins through is going to cause major fatigue. It's going to have the toxins just sitting there. It's going to cause a lot of problems. So anything you can do to avoid constipation, colonics, enemas. Coffee enemas are really great for increasing the secretion of bile, which is important, as I mentioned. So that can be helpful. Getting enough fiber, being hydrated, exercise. You could add some magnesium or senna if you need to. Bitters are good for your digestion. Eating real and whole foods without sugar, just natural fiber, lots of organic vegetables, that's ideal. And chewing your food really well. Like, it sounds so simple, but make sure you're chewing your food a lot. Like really, really, really chew your food. Just doing that, you could maybe avoid digestive enzymes. So just doing what you can to get your system working as optimally as you can is going to go a huge way in treating mold. And again, just making sure you're draining, making sure you're getting things out before binding. Binders are great. Binders are really necessary to bind up those mycotoxins, but we need to make sure everything else is working optimally. Cholestyramine, at the conference I was at this weekend, there's a lot of mixed feelings on cholestyramine. It's not going to hit all of the mycotoxins, and if it's going to cause any issues with constipation, then it might not be your best binder to choose. So zeolite, bentonite clay, activated charcoal are other options. There's also bioactive carbon binders by Cellcore. So those don't strip your nutrition and they get across the blood-brain barrier. And yeah, so I think, and food, we want cultured food, cultured vegetables, fermented food, bone broth. Those are all things that are healing for the gut and the microbiome. And so the microbiome itself is actually basically a biofilm, and it's made of, we have our microbiome, but also our mycobiome. So the fungal species that live in us and that regulate inflammation. And it's just funny how our body mimics nature. You have like fungus out there in nature, and their mycelium is kind of like the internet of nature. They speak, the trees can speak through the network of the fungal systems, and they can shunt different nutrients to each other to help each other. And it's kind of how our body works. We have bacteria, we have fungi, we have these things. They're all supposed to live in this nice symbiosis and help each other and help our body work adequately, but we have to give our body the tools. And what has happened with our modern society is that we have been eating too much sugar, and then the fungal species can kind of overgrow, and the bad bacteria, and that throws off our whole microbiome. 80% of your immune system is in the microbiome, so it's going to make it even harder to heal. These fungi are purposely telling your immune system to be suppressed so that they can keep flourishing, so that's going to affect the Lyme. So the main take home is that mold is not usually alone. So you might want to look for candida, tick-borne infections, viruses. If you already have Lyme, you might want to consider mold. These things tend to go hand in hand because it's about the host and how healthy the host is. And if the host is not healthy enough to avoid being overtaken by one bacteria, then there's a chance that there's going to be some other things that are going to be taking over as well. So it's important to look at the comprehensive picture. And then the final message, my most important take home from this particular conference that I really liked too, that was stated, was listen to your body. It's smarter than all of us. And I think that's really what it comes down to, is listen to your body. There's so many symptoms. You don't really know what they're coming from. There could be so many issues going on, but listen to your body, listen to your gut. Be knowledgeable, know the different options out there, the different things it could be, what to look into in your environment and in your body, your nutrient deficiencies and how you're methylating and how you're detoxing. Be aware of everything, but ultimately listen to your body. Your body knows best, and you know best. And of course, get the guidance that you need from other practitioners, but ultimately you know what's best, and listen to that and use that to guide you. And there is a way out of this. I know it's very, very complicated. I had multiple co-infections. I had Lyme and Bartonella and Babesia and mold issues, as well as many other viruses and things. And I was able to get through all of it. You know, it took some time. It took some layers. It took me 4 years to get well. And it's a puzzle, and there's not an exact answer, and it's not going to be like, here's your protocol. It's going to be like figuring out the puzzle as you go, readjusting, listening to your body. And it's different than a lot of diagnoses out there, typical diagnoses in Western medicine. So it is a complicated puzzle, but I am very sure that you can get through it with some persistence, some education, and listening to your intuition. So I hope everybody has a wonderful day. And thanks, Robin and Katie, for tuning in. If you have any questions about mold, or you want to share your story, your journey with mold, feel free to comment below. Bye.